Pradeep sir, am I audible? Hello? ऐप नहीं चल रहा। हेलो, मला नाही येत आहे. Now it is clear, Pradeep sir? Good morning, one and all. I, Dr. Sarita, welcome you all in today's session on transforming future of healthcare through artificial intelligence. Today's speaker for this session is Dr. Meenal Kulkarni. Having rich experience of more than 13 years in academics and healthcare industry, presently, Dr. Meenal Kulkarni is an assistant professor at Symbiosis International University. She has done her bachelor's, master's, and PhD in the field of healthcare management only. She has published over 30 papers in peer-reviewed journal and chapters in books. She has also presented papers and spoken at various conferences. Now, without making any further ado, let's begin the session. Over to you, Dr. Meenal.
Thank you, Dr. Sarika. Welcome to all of you, the students of Open and Distance Learning Institution of Symbiosis. And today I'll be talking about transforming future of healthcare through artificial intelligence. And I'm sure that most of us are quite aware about how the disruption is happening in the industry right now with the current pandemic going on, and with so many of us relying on our mobile phones and gadgets to seek information, and with the recent vaccination drive, how we are relying on the COVID portal, Arogya Setu app, and we are doing and inching towards getting benefit of all these things which are happening. So I will be giving you a brief overview about what this session will entail today. And this session we are going to discuss about the basics of artificial intelligence, the uses, the benefits, and what are the broader areas and aspects of artificial intelligence and how it is impacting the healthcare and the future that will we be seeing in coming years to come. So to give a brief introduction, let us start with understanding what is artificial intelligence. Artificial intelligence is nothing but mimicking what a human being would be thinking, reacting, and coming up with a solution for any given problem. So instead of a human, it is a machine, it is a software which is doing it for you. So the theory and development of computer systems which will be able to perform the tasks that require human intelligence is what artificial intelligence is, that we and you know about right now. And there are many things that we normally use in our day-to-day life which work on artificial intelligence, like motion sensors of light. When we walk in, they switch on, and when we walk out, they switch off. When we are, going en route, and there are certain routes which we find on Google Map, and it shows us the different directions and directs us to different routes. That is also a little part of artificial intelligence. When we are doing something on our Gmail, and when we surf certain thing on internet, and then later on when we get the notification, that is also an artificial intelligence. So in and all, there are three broader aspects of artificial intelligence. It deals with visual perception, what we see and what we feed in the data. the translation between the languages, and we now know that if we speak in Google, or if we speak to Alexa and we ask to translate, it will translate English into different languages that we want. There are softwares which are doing it readily for the tourist and for the people who find it difficult to understand a particular language. Then there is a speech recognition. I gave an example of Alexa. We speak to Alexa and then it translates the question or the voice message, and then it gives and respond to us. So these are the basic areas where artificial intelligence is commonly used in our day life, and we have not realized it, but then in healthcare it is making much bigger waves, and the accuracy of the diagnosis and the accuracy of the treatment protocols for the patients are becoming more and more vital and more accurate as we go ahead, and we will see in the session today. So in healthcare, what is the artificial intelligence? So there are tasks which range from simple to complex in the healthcare, right from giving appointment to the patient till the time performing surgery, treating the patient and giving discharge summary in the hands of the patient or caregiver are all the tasks that are being performed in the normal hospital setup. When we are talking about the complex tasks in the healthcare industry, they may range from R&D, working on the genome sequencing, working on the precision medicine and all these things. And we know that these tasks are quite complex in nature. So these tasks range from simple to complex. And in here on the slide, we have the entire list of it, like answering the phone to medical record review. Population health trending and analysis is if I am working as a statistician and I need to know the demographics, upliftment and the trends in the data and how it will impact the disease condition in time to come, or how my population is reacting towards the current pandemic situation, I will have a predictive analysis working towards it. Then therapeutic drug and device design is something which is coming up in big way. Reading radiology images, and there are many companies and startups not only abroad but also in India who are working in coming up and associating artificial intelligence in diagnostics, particularly with the radiology. So these things are coming up. Clinical diagnosis and treatment plans are being decided, and they are decided based on the data which is fed into the system. Talking with patients is also being done in Western countries, and there are many hospitals which have many automated machines, answering machines installed in the patient's room. Whenever the doctor or the nursing or the attendant is not available and there are common questions which the patient intends to know the answers for, they may ask to the answering machines and they will give the response based on the data and based on how we have taught that machine to behave. So that is what the artificial intelligence is bringing large amount of disruptions in the healthcare industry. What are the aspects of healthcare artificial intelligence that we should know about? So it comes in many forms. So artificial intelligence that we are talking and discussing right now, it comes in many forms, and the levels of complexity is also large. One need to understand the application of artificial intelligence from the perspective of how it is being created and fed into the system, and ultimately how it is being used. So they are performing various different tasks in the healthcare, which are primarily classification and prediction, as you can see. So the classification task of artificial intelligence is used in diagnosis, and prediction is used obviously to forecast the futuristic trends, and they will help us to match the treatment to specific patient based on the past records or past trends of the patient or of that population or community. So classification will give us the category of diagnosis. Prediction will help us in predicting what the future analysis will hold, and these combination of classification and prediction will help us in planning the better treatment or care for the. Now the third use of artificial intelligence is automatic speech recognition. That we know that Siri, Alexa and Cortana that we have, they use the embedded system and they recognize the human voice. They analyze it with the previous data which is fed in them, and they come up with a response. So they are built in system and they are fitted in patient room nowadays, and on demand answers can be provided where that gap of asking question and receiving a response is minimized to a great extent. So the patient doesn't have to wait only for doctor or nurse to come in and answer his queries regarding his treatment. If we have already given Alexa or Siri like device ample of information and data regarding patient's condition, and the responses can be then developed having certain devices embedded in the patient. Yeah, with the help of my software, then what will happen? I have already fed so much of information with respect to X-ray images, CT scans and MRI scans, that with all these permutation and combination, ultimately I'll be receiving what is wrong with my current X-ray that I have fed in the system, where the anomaly lies and where the accuracy of the treatment can be given. So these things are done with the large amount of data that is fed in the software. We are asking the software to learn from the data that we are feeding into it. And then it can be equipped with learning and self-correcting abilities to improve its accuracy based on feedback. Like when we, for example, when we ask Alexa, play this song from this and this movie, if it has it, it will play it right away for you playing this song. And if it doesn't, it gives us an answer also very intelligently that currently I don't have option for this and this. Do you want me to play another song in option to that? So that is how we have trained the system, and the options are available for us, and therefore we are talking about self-correcting abilities and giving the feedback based on the response that we have been asking to the machine. The AI system can assist the physician by providing up-to-date medical information from journals. So this is a different aspect of how AI is helping the physician to approve and upgrade the knowledge of the physician, right from understanding what are the latest developments that are being discussed in the journals, textbooks, and clinical practices to inform the physician to better the patient care. So AI is used in that also. Readily in front of him, the information can be gathered and can be put at one place where it is easy for the physician to scan and go through it. Instead of going physically from journal to journal and from textbook to textbook, it is all available at one place. So that is the beauty again of artificial intelligence. This system also helps to reduce diagnostic and therapeutic errors that are inevitable in human clinical practices. So sometimes there is a warning sign which gets pop up in the system giving us an indication that this is not right or this patient needs an extra care. The levels are dropping and there is an indication which will come up, or there is a responsive mechanism that will flash. So this will make us ready in advance to take care of any untoward event that is likely to occur in future. So these systems are extracting the useful information from large patient population, and mind you, this is a very complex thing. First and foremost, there has to be data that should exist, and this data then needs to be properly channelized to be fed in the system so that we can have this AI mechanism working for the healthcare industry. Now, there are many avenues from where the data can be collated and created. Okay, we have all the images that are uploaded in the software in the hospitals. So these softwares already are a huge bank of data. Patient records that we have in our system are already huge bank of data and information. So combination of these various information that comes from the hospital prima facie and from the background information or the secondary sources are then fed into the system, making the real-time inferences for health risk alert and health outcome predictions possible through AI. Then how does it work? We are talking about AI, we are talking about large amount of data, but how is this combination happening and taking place? So in a nutshell, before the artificial systems can be deployed in healthcare applications, they need to be trained through data. That is what I have been speaking from my slide 1, that for anything to behave in particular way, we have to make that thing learn certain things. Like for example, even for robots, when we used to see robots from past few years, if we recollect our memories and go back to the robots, then the robots were fed with some information to behave in certain way. Now those robots were limited with certain functions that were already embedded in them. Now we are talking 2 or 3 or 5 steps ahead, talking about artificial intelligence, whether it is taking the data, it is covering the data and the sources, and it is making a behavioral change on its own. Okay, so it doesn't depend only on the pre-fed information, but it has a capacity to learn more from the environment around and then reacting and giving certain solution to the problem. So we talk about training through the data. We are now moving on generating the clinical activities such as screening, diagnosis, treatment assignment, and so on, so that the machine can learn similar group of subjects, the association between subject features and outcomes of interest. So if I am feeding information with related to particular disease or particular population group or community, it will give me accurate results and prediction about that community and that population. And therefore nowadays when we see and read in newspaper, magazines or journals, there are many articles which rely on the predictive analysis and use of artificial intelligence to predict the future way the disease will mold, the future trend and analysis, how particular community will be more reacted to, with the disease, and how particular community will be more conserved and preserved from a disease. So these are all the functions and the elements that the AI can help any healthcare provider, organization or an individual to come up with a solution. Now, these clinical data exist in the form of demographics. Now, when we talk about data, what is the type of data that we have in front of us? So they are existing in form of demographics, that is your name, age, gender, your other details from which region you belong to. Then what are the medical notes that a particular patient is having, okay, with respect to the treatment, and what are the electronic recordings from the medical devices. If I am having a patient fitted with pacemaker, if I am having a patient fitted with Fitbit, okay, all the time to record the sleep patterns and everything. Now all these things is giving me an accurate data with respect to how my patient is behaving and responding when I am not taking care of him physically. So there are many things which are happening at back of my this thing behind my back when I'm not physically seeing my patient, but still they are being taken care of and they are being monitored with certain medical devices and gadgets. So now this, along with your physical examination and the results obtained from clinical labs and images, will give you a comprehensive data set with respect to a patient. And imagine if we can have such kind of comprehensive data set for entire population or for maximum number of people who are coming and visiting our hospital in general, then the process will be so good and the process will be so useful in terms of coming up with the optimal solution. This is a roadmap for clinical data generation, how it works. Now here in between you can see that we are pointing the data which is coming from electronic medical record. We are talking about images that I just spoke about with respect to radiology and the genetic and EP data. So all these things are generated. Now there are certain things which you will see, what is NLP, that is natural language processing, machine learning, and also certain other two terms which we will discuss in our coming slide and how it helps in creating all this. So we have the data, we have certain algorithms which are run to convert this data to teach the machine certain things, and that is what is converted into artificial intelligence. And this is what is your input, this is what is your output, and what we get is our clinical activities, screening, diagnosis and treatment as a result of how artificial intelligence is working as an intervention with all these inputs. So we spoke about all these terms. Now let us understand the basics of machine learning, deep learning and neural network. Now these things are courses and subjects in their own right. Because of the paucity of time, it will be little better if we just touch base on the basic definitions of these terms so as to have a better understanding of how artificial intelligence work in that perspective. So machine learning is nothing but you are making a machine learn something. Okay, so an artificial intelligence system's capability to learn from data and improve its performance without being explicitly programmed. Now, this is what machine learning is. It is the ability to get better with experience. Okay, so for example, when we are working on our computer and we happen to browse through Myntra or Amazon website for that matter, and then we close it and we again start working. On the side windows, we will see that it is prompting us to know that you would like to visit this site for certain products, okay, which we have seen in the past. It is now in the history, and based on our liking and browsing, that is giving me another chance to look at it. How does the machine know what I was interested in and where I want to look at, and it is giving me an option. It will also show me that if I'm interested in discount or not. Now this is what the machine has learned, and that is what artificial intelligence has made it possible to learn. We go on Facebook, we go on Instagram, we see particular type of things, and it will prompt us, and the feeds that we will receive in future will all be associated with that kind of thing. If I am too much interested into, for example, cooking, or for example any other thing, for example healthcare lifestyle, this thing, then it will prompt me with the feeds which are akin to healthcare lifestyle or cooking, because it has captured my interest, it has programmed itself, and now without any supervision, it is giving me something which I was looking for in the past and which I may be interested to look now. Now this is what artificial intelligence is doing, and that is what we mean by machine learning. Second aspect is deep learning, which is again nothing but a subset of this machine learning. This refers to capability to learn from unstructured information. Now here what we were talking about was learning through certain structured data where data has a form or data is labeled. Okay, like images. Images is acting as a label for particular set of information or the data. Now here we are speaking something that data is unstructured, it is unlabeled, but still the machine is able to identify and come up with some response. So that is an aspect of deep learning. So this is the ability to set the computer loose on a data set that isn't labeled. So we are not talking about labeled and structured data when we are talking about deep learning. Tagging someone on Facebook with name is something which is an aspect of deep learning. It has learned, okay, it will give you a prompt, and this is how these two terms will act as an important feature when we are talking about artificial intelligence. न्यूरल नेटवर्क इज नथिंग बट दीज आर, जैसे हमारे ब्रेन में न्यूरॉन्स काम करते हैं, वी हैव अ न्यूरल नेटवर्क ऑन द सेम लाइंस. These are the machine learning experiences which the computer learns from such kind of networks. These are basically the algorithmic networks which are embedded in the system through machine learning or deep learning to give us a particular information as an output. And natural language processing is just the capability of computer to process and understand human language. So all these are an important element of artificial intelligence, and you will come across these terms when you read anything related to artificial intelligence. So these are the structured data, unstructured and unlabeled data. These are the networks and the algorithms, and this is the speech recognition capability that we are speaking about. Then the uses of artificial intelligence as basic as scheduling of operation rooms can be done. And I'll show you a video at the end of this session where you will understand what I'm speaking right now and how the availability and the capacity of the room can be known to us in advance, and we can help scheduling of the appointments for the operation room for not only today and tomorrow, but for the entire week and for the entire month. So it will do all the calculation based on what the past records are, how many patients were treated, how many patients were wheeled in for surgery, what kind of surgery were prominent, what kind of surgeries were least performed. So depending upon all the data that is being fed in the system, it will give me a utilization and scheduling of the operation room. Now, the artificial intelligence will also help in detecting the onset of sepsis based on the patient information that we already have in the system. Now, it will help me in giving me an advance warning that this is likely time duration when the patient may go in sepsis. So, you please have an early detection to save the life of the patient. Another area that can be explored through artificial intelligence is risk of mortality and readmission. Now here the readmission thing and mortality is something which are important indices in the hospital industry. How many patients are likely to suffer because of this disease and how many readmission are we seeing in future, which may be an added financial burden on us. So all these things can be understood, they can be analyzed, and we can prepare ourselves if we know in advance what we are looking at. So the hospitals are using algorithms to target interventions to particular patients because there are many things which are going on, and if I am talking about a particular area like for example cardiology, if I'm talking about neurology, then these kind of our algorithms are helping in big way to come up with some interventional solution which will be life saving to the patient. Precision medicine, we all know that precision medicine coming up with so many solutions which will help in R&D of the pharmaceutical products and devices in future is big way which will help the humankind, and thus the benefits of AI can be discussed and enumerated in the coming slides. So right from the patient self-service to chatbots. How many of us have visited a website of a hospital and the chatbot pops up and it is able to answer my frequently asked question with equal ease and with equal satisfaction, which a real person would be able to do when I pick up a call and ask and inquire about it. So these are the examples where you are using it, but you don't know the mechanism which was going behind and giving you the response. The computer aided detection systems for diagnosis is another area. Image data analysis to identify the molecules in the drug discovery, and they are increasing the convenience and efficiency, like we spoke about scheduling of operation rooms, giving appointment to the patient, reducing the cost and error because already the futuristic plan and the predictive analysis is available in front of us. So we are minimizing the errors, we are saving on cost, and we are making it more and more easier for the patients to receive the help they need. So less and less will be done by the physical doctor or the nurses, where they are burdened more on the paperwork. If more information is fed already and automated responses are obtained, then the care that the doctor and nurses should actually give to the patient will be possible. Right now the scenario is very different, where they are immersed in huge amount of paperwork, feeding in computer systems and doing all this. But if we have speech recognition and we already have automated data which will help us in reducing all these things, then it will be a great change in the healthcare industry that we are about to see. So the ultimate aim of all these things will be that it will help in improving the provider and clinicians' productivity and quality of care. Like I said, less of paperwork, more of patient care. And it will enhance the patient engagement in their own care, and it will help in streamlining the patient access to the care. Having someone automated system fitted in your room answering to your query, you feel engaged with that. Although the human interaction may not always be possible, but there is someone who is helping you come to a solution and having a response to your queries. Without that, if you compare a situation where you are just sitting and waiting for some answers to be obtained, it becomes more frustrating than having someone to do that job for you. Then the artificial intelligence is also helping in accelerating the speed and reducing the cost to develop new pharmaceutical treatment, and more amount of work which the human can do and spend on R&D will be replaced with the huge data set and the huge amount of information which already will be available. So ultimately it will help in reducing the cost. The time required to come up with the solution will also be reduced. Personalized medical treatment by leveraging analytics to mine significant previously untapped stores of non-codified clinical data is something which is again looked at as a benefit of artificial intelligence in this area of clinical research. Then with AI technology, the significant contribution can be the synergies that are generated by using them together across the entire patient journey, right from the diagnosis to the treatment to the ongoing health maintenance. So the treatment doesn't end when the patient leaves the hospital with the discharge summary, but also it continues with the health maintenance when the patient is out from the hospital and still doing a follow-up of the health related things from his home. So all these aspects are coming together in two categories of benefits that we see. What are the benefits to the patients and what are the benefits to the hospital? To the patient, the use of artificial intelligence will bring in more convenience. It will help in faster and easier scheduling. You go on app today, you have Practo with you, you are able to find what are the nearby doctors which are available to you. You book an appointment through Practo, it gets reflected in their scheduling system, and there is not even a phone call which is being made nowadays. Okay, so that is what is making the life easier and it is making it more convenient. Convenient bill paying, you get automated bill generated in the interim and the itemized bill on your mobile phones, and you can keep on making the payment to the hospital with GPay and with the electronic payment options that are more and more available to us right now. Everything is becoming more and more convenient. Less time spent on filling out forms. Right now, if we go in the hospital, the registration form itself is 1 or 2 pages. The time which we spend, 10 minutes of crucial time that we spend in filling out the forms, which will not happen if your information is already available. And with National Digital Health Mission, which is just announced by the Prime Minister of India, all this is possible if at a national level the electronic health record system and at the hospital level the electronic medical record system is adopted in full-fledged way. There are certain apprehensions though how the security and the accuracy of the data will be managed, but eventually when we go on, these things will be sorted and there will be more and more benefits rather than the counterpoints that we can discuss about. The benefits with respect to the hospitals talk about reduction of cost. The manpower intervention will be reduced to some extent, so we will save the cost of manpower. Wait time is something which is a very big deterrent to any hospital operations. So if we are scheduling online and if we are giving a precise time interval through our softwares and artificial intelligence to both the doctors and the patient, the wait time is reduced to a certain extent. There are chances of committing fewer errors because of the precision that and the accuracy that the artificial intelligence is providing to us. Easier payment option, which is a commonality between the two groups. Increase patient satisfaction because of the convenience and the ease of mode of operation which the patient will also experience. The points which we as administrators should remember, or we as someone who will be implementing AI should remember, or we as someone who will be experiencing or using the AI should remember, that extra time and cost for early adoption will always be there. So the small projects, even if they require additional time and effort to perform business case validation and proof of concept. So the healthcare is right now at that stage where it is doing the experiments and there are multiple small projects that are being run, and therefore the efficiency and the efficacy of all these systems and mechanism is being tested. So once we have all the data available with us, the time required for application, implementing and seeing the results will be reduced to a great extent. Obviously, for anything to work, there is large amount of groundwork which needs to be done first. And that is what is happening right now. But once it is done, it will help in reduction of the cost and complexity by hospitals going and leveraging the open source technologies and limiting the customization. So every time it is not possible for all the hospital to go for customized services of artificial intelligence given to them. There are various open source technologies which are available that are free of cost to certain extent with certain features. And later on, when the usage increases, you may have to pay certain amount to the service provider. So with artificial intelligence coming in big way, you can start small by utilizing the open source technologies. The built-in solution for average transaction length and volumes with capacity of longer transaction and peak volumes has to be analyzed, and that also has to be factored in. So the training of the models and the training of the software is an ongoing process, and therefore any organization who wishes to bring in AI has to be ready to spend and to invest at the initial stages, and should have patience for the testing time period, and therefore later on the benefits of it can be realized. So these things has to be kept in mind, or points to be remembered when we are talking about AI in healthcare. The challenges which come obviously with anything that we talk of, anything which is new, anything which is old. So challenges are part of everything that we know of. And primarily, it is patient privacy and the ethics of data ownership that we have to look at if we are talking about electronic medical records, electronic health records. Now, accessing the personal medical records is strictly protected. That has to be the rule that we have to abide by. Should hospitals be allowed to continue to provide vast quantities of their patient data, even if de-identified, to a third-party AI companies? Now, these are the questions we have to have answers for, which are currently you and me cannot know or cannot tell right now. These are for the authorities to decide and come up with. There are guidelines and blueprints available for NDHM right now if you go and find out on the site of Ministry of Health and Family Welfare. But all these questions will keep on popping time and again if we are utilizing the patient data in correct way. Are patients comfortable sharing their personal details and data with us? And how do we protect the privacy of the patient? And what are the consequences if there is a security breach? So there are a lot of things that are unanswered right now. In Western countries, they are coming up with the solution. They have implemented to an extent. We have to see such an implications right now in India, where we can implement all these things on a full scale. Quality and usability of data is another challenge. So in other industries, what happens? The vast amount of data is generally reliable and accurately measured. If I'm talking about a manufacturing firm, if I'm talking about something like here, an example of aircraft engine sensor is given, I have all the mechanism to see, physically measure and analyze and accurately give the solution at the end. But in healthcare, the data is subjective. Something which is happening to me may not happen to you. Something which is happening to my kid may not happen to your kid. So it is very, very subjective. Although having same disease, but it is so subjective that every case is different. So therefore, the accuracy cannot be relied on. And these includes the clinician notes in electronic medical record, which are unstructured and can be difficult to interpret and process. So if a subjective case requires certain clinician's advice or treatment, it may differ from patient to patient, and therefore it becomes more and more difficult to process such kind of information. And therefore the quality and usability of data is again something which will act as a limitation. Data inaccuracy. So a patient may be listed as a non-smoker, for example, but where they just reluctant to admit that they had not been able to quit, and therefore they just gave an answer that, oh no, I do not smoke cigarette. But later on, the entire diagnosis is dependent on the crucial 2-3 questions that he answered at the initial stages. Now the machine will have to work on what is the information that is fed. Whether that information at the time of asking was given was true or not, that is very difficult to identify. So again, we are not sure about the quality and the usability of the data. Then the data sources are siloed. They are separate across many service providers. So insurance company will have some different data set. I as hospital provider will have some different data set. Then there is some other third party association which is involved, which will have different data set. So there is no amalgamation of the data which is happening currently. So it is very difficult to capture a full profile and range of determinants for a patient health if these kind of data is stored and saved at different places which do not show any connection with each other. So there is a possibility of coming and working for a solution where such data sets can be connected. As I have already told you that these are the various areas where it is applicable, like radiology, drug discovery, patient risk identification, and primary care and triage. So these are basically the things which are happening currently with the AI in the healthcare industry, and we can use these things to better the service care for the patients here. Now here are two YouTube links which I'll play, and I'm sure you will get a good deal of understanding of these things. The quest for artificial intelligence began.
We can rescue.
Can perform 36 distinct acts.
The idea was that computer technology would one day be powerful enough to carry out tasks better and more efficiently than humans.
We've got to actually say hello to it.
Today, AI has come of age. It's already having an impact on many parts of human life, from self-driving cars to finding soulmates. But perhaps its greatest impact will be on medicine and the way we monitor human health. Dr. Eric Topol is one of the most influential doctors in digital medicine. The pioneering American cardiologist has helped develop drugs that have saved countless lives. He's now at the forefront of the AI revolution in healthcare. These are his prescriptions for transforming the future of human health.
The overarching goal is to bring back the humanity. If we do this right, we can rescue the problems of healthcare.
The doctor-patient relationship is a founding principle of healthcare and medicine.
The first step is to eliminate keyboards and computer screens in clinical encounters.
Some doctors in the West can spend up to twice as many hours on medical paperwork than with their patients.
In the years ahead, we should be able to eliminate the data clerk functions of clinicians. These are mutually hated as much by patients as by doctors and clinicians.
AI tools, such as speech recognition technology, that are now commonplace in homes, could be used in clinical settings for capturing data and notes, allowing doctors to concentrate on people.
We have a problem with accuracy and efficiency.
Trained on a huge resource of medical data, the power of AI learning can read some images more accurately than humans.
Whether it's a pattern like a scan or a slide, or prediction AI can really rev up the accuracy, and that is important for a better diagnosis, better treatments, better outcomes, lower cost.
Powerful machines can interpret scans 150 times faster than radiologists and can work 24 hours a day. AI can even suggest a diagnosis.
Many conditions could be AI diagnosed. And so the time that a doctor comes into play is very specific to important diagnoses.
Data is critical for improving our understanding of disease and illness. The more we understand, the better the chances of preventing, diagnosing, and curing. But currently, only about 5% of medical data is used effectively.
We had a problem with generating so much data, terabytes of data for each person, but we didn't have a way to analyze it. We didn't have a way to extract the juice, the distillate of this. Now we do. And that's what artificial intelligence is really about.
Harnessed to wireless devices, AI could oversee every facet of people's health data, from family history to food intake to exercise.
People will have the opportunity to have this real integrated view of themselves to help prevent illness, to help guide them for better management of conditions. Over time, we'll see this virtual coach for promoting health.
Constant AI monitoring could transform the most prolific diseases that demand the most care, such as diabetes. This would empower people to take charge of their own health.
Another way that AI will kick in over time is to get rid of hospital rooms. We can monitor patients in the comfort of their own home because they can have the sensors that would provide the same type of monitoring as if someone was in the intensive care unit.
Caring for people outside of medical settings would not only prevent hospital-acquired disease, it could also save money.
All these things favor this shift of reliance on a patient's bedroom rather than the hospital room. We're talking about a whole lot of people that don't need to be employed in the hospital setting. That is a great way to reduce the burden in the future. In the United States, a hospital costs $5,000 a night, so you could get a lot of data plans that go for years for that cost. If the clinical community stands up for patients and say all the power, efficiency, productivity, workflow from AI is going to be used to give the gift of time to doctors and nurses and patients, that's where we flip this thing and achieve a rescue mission for healthcare.
So yeah, that was from my side with respect to this session. Done.
Thank you, Dr. Milan, enlightening our student about artificial intelligence. So there are few queries have been asked by students, so I'll take it one by one. One of the students has asked, like, can you please brief us about deep learning?
Deep learning, as I said, is an area where the algorithms are given to the machine, and then eventually over a period of time, machine learns by itself. Okay, so you don't need to feed in the information again and again for machine to perform or give the outcomes. But deep learning is such a system where you give a brief information and you feed the information and the data, and then machine has an acquired ability to learn with the changes that is happening around us. तो जैसे हम जब टाइप करते हैं मोबाइल पे, हाउ आर यू, इफ वी टाइप टू मेनी टाइम्स, ultimately what happens is when we just type how are you and question mark comes automatically. So that is what machine has learned over a period of time, and it will give us the automatic results.
Thank you. The next question is, as the challenges are there in AI implementation in healthcare. So even a small error may cost patients' life. So how can it be implemented effectively and safely? And what is the future of AI in Indian healthcare setup?
See, Indian healthcare setup is right now at the verge of starting and getting involved in AI, I will say. So we have seen the use of telemedicine and teleconsultation in the pandemic just now in last year. How we have transformed from going physically to the consultant to visiting consultant through our mobiles and through our computer screens. So that shift is already being there. We have accepted this change. Yes, when we talk about accuracy and talking about the errors and the costs, it will take some time for acceptability and the generation of information in the data. And with this usage, the source of information which we will have, the accuracy will be obtained and the errors will be brought down. That is my take. And there are many doctors and clinicians who are coming forward and they are very pro in using AI. We have seen how robotic surgery is changing the scenario. Right from laparoscopic and keyhole surgery, we have come to robotic surgery now. The cancer treatments and the accuracy with which the cancer is diagnosed right now has reached to a peak with AI. So there is acceptability, and with time, it will be more acceptable, and that is what the future is.
Right. So, since AI has evolved over the time in surgeries also, right, in robotic surgery, so are there any special like installation of such kind of equipments or machineries will require if we are planning to implement it in a
Yes, yes.
existing healthcare setup?
Yes, definitely there
So,
will be. There will be.
uh, one of the student is asking about like, can you share few reference books or material on telemedicine or AI?
I can share with the SSODL's staff members, and maybe they can pass it on to you for
Yes, yes,
the further
yes,
use.
yes. Yeah, we will mail to all students.
Yeah, we can do
Yeah.
that.
So in India till now AI being used in OT scheduling or something. So are you aware about anything? Student would like to know about it.
Uh, I cannot take names right now offhand, but there are a couple of hospitals which are using AI in scheduling of the appointments. They are using it for OPD appointments and scheduling, and they are also using for providing triage care in the emergency room. There are 2, 3 hospitals down south in Bangalore which are using AI in doing these things. But right now, I cannot give you the names offhand.
Right. So, since human lives are involved while implementation of AI in healthcare, so what about like the human characteristic like empathy, compassion, which is actually being provided when like direct care is being provided?
Now, I would say there are two aspects to it. One is that when we as a human get burdened too much with work, there is a burnout syndrome which we all know.
Right.
Okay, when we are suffering from burnout syndrome, obviously the empathy, sympathy, which we have to give otherwise, will come down. When our majority of the work is taken care by artificial intelligence system, I would say the empathy, sympathy, and the closeness that we may have with the patient will increase. There will not be a decrease in this, but there will eventually be an increase in this thing. So human behavior will adapt, human behavior will change, but yeah, there are certain pros and cons which we have to adjust to, and we have to decide which is good for us and for the patient.
So, few of the students are commenting, they have liked the session and the session feels more interesting to them. So, these are all the queries and you have answered all of them. So, thank you, Dr. Meenal,
Thank
joining
you.
with us. And here I declare that session is over. Thank you. Thank you
Thank
all
you.
the participants. Thank you.
Should I leave the meeting now? Should I leave?